Dr. Prabhav Rawal, and today I am going to demonstrate the breast examination, which is the part of OSCE video of gynecology. So first of all, we will greet with the patient and ask for the consent for the breast examination. So hello Alicia, my name is Prabhav Rawal, and today I am going to do your breast examination. Is it okay with you? Okay, make sure you ask for the consent of the patient, and a female relative of the patient or nurse should be present in the examination room, and the room temperature must be adequate according to the examination of the patient. So now we have two procedures to go with the patient. First procedure is the inspection. For the inspection, there are three positions. So for first, I will ask the patient to lean forward and put her hand on the thighs, and I will note for any asymmetry, for any scars, and any movable mass that can be shown while patient place her hand on the thighs. And for the second position, we will ask the patient to put her hands on the hips and contract the pectoralis muscle, and we will note any movable mass that can be the sign of malignancy. And the third position, we will ask the patient to put her hands on the head like this, and ask the patient to lean forward, and we will check for any movable mass. So, no, रुक जा.
बोलता रहे बाद में काट लो.
So for the third position, we will ask the patient to put her hands on the head and lean forward like this, and we can observe the breast very closely. Now I am going to start with the second procedure, which is the palpation process. For that, I will make sure that the bench can be flat, or it can be the inclined bench of the 45 degrees, and ask the patient to put her hands on the back side and lay down on the bed. And so first of all, for this, if you are going to touch the breast, for that your hands must be warm, so that because you are going to touch the breast of the patient, you are going to check the breast of the patient. And for that, first I will remove the one side of the patient's breast, and then I will look for. Make sure your hands must be warm, and now I am going to check for from the any nipple discharges coming out or not. For that, I will just put pressure gently over the nipples, and then I will look for any exudate or any liquid coming out of the nipple. So it can be a sign of breast infection. So for the next procedure of the patient, I'm going to palpate the breast of the patient with the help of my three fingers, and this is the spiral method. So we have to check any movable mass or any asymmetry and any lesion over the breast. So for that, I will use the spiral method for this. So now I am going to. Make sure you do not leave any place or the breast. So I am done with the breast examination of the asymptomatic breast, and now we will do with the second breast, and the procedure is the same. So now I am going to check the patient for the any over the axillary lines, and there are three axillary lines. So first I am going to palpate the anterior axillary line, and then followed by the mid axillary line, and then followed by the posterior axillary line, and we will note any tenderness, lesion, or any scar in the part of the axilla. So for the last part of the procedure of the breast examination, I am going to palpate for the lymph nodes. So first I will go with the cervical lymph nodes, and then followed by the supraclavicular, and then the infraclavicular, and then for the last we will I am going to palpate the para-external lymph nodes or the sternum. So now I am done with the breast examination of the patient, and I can't find any movable mass or any asymmetry and lesion. Thank you.